It impacts virtually everyone in America.
The Affordable Care Act is here to stay.
But the president's plan to provide health care coverage for all is not without controversy.
Obamacare is a train wreck.
Whether you are for it or against it, the Affordable Care Act is the law of the land. But it's also a political and social lightning rod. We discuss it in this special town hall meeting. Your voice, your future. Hello and welcome to our special town hall meeting on one of the most hotly debated issues of our generation, the Affordable Care Act.
Now, supporters say it helps keep health care costs down and provides coverage not available under previous policies, such as pre-existing conditions. But opponents say fewer people will be able to afford health care, and the delays in implementing the law are a sign that it is beyond repair.
Now, to help you better understand the Affordable Care Act and its impact on all of us, we have brought together experts on all sides of this issue.
It's your voice, your future, and our moderator, Mark Hyman, is standing by live now at the Western North Carolina Ag Center to start our program for us. Mark?
Welcome to the WNC Ag Center. Good evening. I'm Mark Hyman, host of Behind the Headlines, and the moderator of the Your Voice, Your Future Town Hall. Tonight's topic, the Patient Protection and Affordable Care Act in North Carolina. Now, in October, registration started with the healthcare exchanges, and not without a lot of controversy. We're going to talk about those exchanges and a whole lot more tonight. Now, we've got a packed audience here anxious to get started. We also have a great panel of experts who have a lot of issues they're going to address. They're going to debate the topic and answer as many questions as possible. But you at home also get to be a part of this important discussion. I'll tell you how you can participate in just a moment. But first, I'd like to introduce our panel of experts. Joining us this evening is Alec Hoffman. He's the program manager at Blue Cross Blue Shield of North Carolina. Leslie Boyd, she's director of WNC Health Advocates. Cody Hand, he's vice president and deputy general counsel of the North Carolina Hospital Association. And Donald Bryson, he's a policy specialist with Americans for Prosperity. Additional information on our panelists and their organizations can be found on our website, WLOS.com. I'd like to emphasize that our panelists are here in their personal capacities. The views they represent are their own unless they tell us otherwise. Now, I mentioned a moment ago that we have an anxious studio audience who wants to get this whole thing kicked off and ready to go, but you at home can also be a part of the discussion. News 13 anchor Frank Fraboni is manning our digital desk. He'll explain how you can be a part of the discussion. Frank?
Thank you, Mark. Folks at home can get involved by going to our Facebook.com/News13 site and giving us their comments and questions. You can also do that at Twitter at WLOS_13. We also have a hashtag where you can get involved with the discussion. That's hashtag WLOS Town Hall. Now, we've been collecting comments and questions and feedback from the public for weeks now leading up to tonight's town hall. We have some of those questions for you. We're going to share them with you throughout the broadcast, but certainly we want to invite you to be a part of this conversation in this town hall meeting. So please send us your questions and your comments through Facebook and Twitter, and we'll be looking for those, and we'll be sharing them with our audience and with Mark, and of course with our panelists who will try to answer all of your questions. So we look forward to that from our viewers at home. Now, let's begin first with a look at the screen, and we'll show you some of the questions and comments that we've received thus far. It may be far from perfect, but you have to start somewhere. All Americans deserve affordable health care. That's from Anna. And then we've had others like, if it were so great, why are Americans being forced to buy it? My insurance for my family has increased and will increase more in 2014. But hey, someone has to pay for the uninsured. That came from Chris. We'll share more of these with you as time goes on. Mark?
Thanks, Frank. Now, this is a town hall. It's all about getting questions asked and answered. And tonight we're going to start off with the very first question from me, the moderator, not to our panel, but to our audience. I'd like my audience to respond with the sound of applause. And your two choices and answers are yes and no. And I'd like you to respond to this statement on whether or not you agree with it. Here's the statement. Americans have access to quality health care at affordable prices. Those who believe yes, please applaud. Those who believe no, please applaud. I want to put the same question to our panel of experts, and if you could just raise your hand. Do Americans have access to quality health care at affordable prices? If you believe yes, please raise your hand.
They're beginning to.
Okay. And if you believe no, please raise your hand. Okay, so It's unanimous on the no side for our audience here, and it's kind of 3-1 for a panel. Sir, would you join me for just a moment? I'm going to go to our audience for our first question of the evening. Sir, step on over here. Please tell me who you are, where do you live, and what's your name? And what's your question?
William Gamacourt. I live here in Asheville. And first, I just wanted to say that Medicaid for the last 2.5 years has kept me alive. I'm a type 1 diabetic that I didn't know I was a type 1 diabetic until I had Medicaid that I could go to a specialist to be seen. And my doctor's an incredible doctor, but that's besides the point. It's actually a two-part question. One is there any hope that North Carolina will expand Medicaid? And the second part is, do you see a pattern with the states that are expanding and are not expanding Medicaid?
Well, let's start off with Alec. Alec, what do you think? We're going to see some expansion of Medicaid here in North Carolina?
That's a political question. Hopefully it does. It leaves a very big hole in the law the way it is right now, that it did not expand Medicaid as originally planned. So ideally, yes, it would expand, but that comes down to the government, the state government, if they do decide to expand Medicaid or not.
What do you think, Cody?
I think that the government left it open to expand. Everybody knows that Medicaid in North Carolina has been plagued with quite a few difficulties. And so I think the state wants to get what they've got fixed before they consider getting some more money put into it.
Leslie, you're shaking your head?
I think that when Medicaid first came about, only 6 states opted in. Eventually, every state did. And I really feel that that's what's going to happen with Medicaid expansion. The states are going to see that it's important to do this for the people who live there.
Okay, we're going to right back to the audience for another question. And this gentleman's going to join me in just a moment. Step on over here, sir. Please tell us who you are, where do you live, and what's your question?
My name is Roy Jensen. I live in Fletcher. And my question is, recently I was forced into retirement. I just turned 62. So therefore I have no insurance. Now, I took the time and the effort to be kicked off of the Affordable Care Act numerous times in the months of November and December. Finally, on December the 30th, I finally got through and got my insurance. However, now I'm being told that the insurance that I'm going to be paying is predicated on whether the young people will apply for insurance by March. Now, I took the time and the effort to get my insurance. Please do not penalize me for what those younger people have not done. That is my question.
So your expectation is there was a certain, your fee, you're going to pay a premium,
I'm paying a premium,
and then it may change because of the lack of participation by young, healthy people.
Exactly.
What do you think, Donald?
I think that that's a problem with the Affordable Care Act in general, is that it does, the financing of the affordable healthcare plans for our senior citizens is predicated on younger, healthy people buying into the health insurance program. But studies are showing that a lot of them are choosing to just simply not buy the insurance because it's simply more affordable to pay the tax penalty when they file their taxes next year than it is to buy the high health insurance premiums under the Affordable Care Act.
If they continue to increase it, I have to drop it. I cannot afford it. I cannot afford to keep me and my wife going. So I'll just pay the penalty. Okay?
Leslie, is there perhaps a fix that would help this gentleman if they don't have the young, healthy people to participate? How can he continue on if the premiums go up?
Well, I think the premium is never going to exceed a certain percentage of your income, number one. And number two, young people are signing up. They're signing up in greater numbers than were expected. And the young people I speak to, I've spoken at a number of colleges to classes and whatnot, and these young people are pretty eager to sign up because they know that they're going to be protected, and they seem to understand that if you get hit by a bus tomorrow, you'll be covered. You might be healthy now, but you never know, and there are more of them signing up.
You know, Alec, just a quick follow-up on this. Since the legislation allows young people up to age 26 to stay on their parents' health care plan, isn't that kind of, well, an obstacle they've created to get the young people to go on the health care plans because they can stay on their parents' insurance?
Well, the goal is to get everyone insured. If you can get everyone insured, it reduces the number of people that go in for services that can't afford them because of the cost of the services. So the idea with the insurance, if everyone gets insured, it pools the risk among the larger portion. Now, keeping someone on their parents' policy or on their own, as long as they're insured, that should help balance out the cost in the long run. Getting back to his question, will it cause his rates to go up? That's something that's we're going to have to see over the long term. The rates for this year won't change. For next year, depends on what's the actuaries determine, the underwriters determine based on the health of that pool. So it's something that could change in the long run.
And I want to follow up with Cody, and it's a slightly different take on what this gentleman just brought up, but since he's addressing some of the unknowns, what are the unknowns for the Hospital Association? What are the concerns that they have with these changes that are coming into place, and how does it affect the hospitals here in North Carolina?
Well, we only have an hour and a half. I want to go back to what Mr. Jensen was getting to. Hospitals have faced this for a long time. We've had to figure out how to make it work on half the population payment. So we're very familiar with that. Some of the uncertainties we face are who's going to get insured. Medicaid's not expanded, so are those patients going to have their own insurance? Or are they going to continue receiving treatment in their hospitals for no cost to them, but cost to those of you who do have insurance? We do have a lot of unanswered questions from the Affordable Care Act. That definitely is one of them. Another is what's going to happen when the Medicare rates continue to be cut by Congress and we don't have the offsets with Medicaid expansion, and we don't have the offsets with increased employment and employers buying insurance. As they continue to push the implementation of the various parts of the Act out, it leaves us with even more uncertainty and more questions on how we can continue to deliver the care that we have gotten used to in North Carolina with our great hospitals at a rate that is unsustainable.
Now, I know we have a lot of questions here, and our social media has been blowing up all week long with people putting questions in. Before we go to our digital desk, I do want to get one more question in from our audience. So please tell us who you are, where do you live, and what's on your mind.
My name is Sarah Skinner, and I live in Arden. And I am wondering whether the states, that chose to expand Medicaid, if they are getting better insurance rates for people than, say, the states that didn't expand Medicaid. Is that affecting the kind of insurance rates that people are having to pay?
Alec?
Insurance rates are based on a number of different factors, and it's hard to pinpoint one specific one. The number of hospitals in the region, the number of providers, the overall health of the state in general. Now that there's no more underwriting, which means that each person's health doesn't determine their rate. Essentially, it's a global rate. So there's a number of different factors. As far as Medicaid affecting the rates, that's probably something that we'll have to look at over a longer period of time. It's too early to know if that's going to cause any rate changes one way or another.
Leslie, did you have a follow-up on that?
We can't know until it really happens, but the rates are trending a little lower in states that are expanding Medicaid than they are in states that are not expanding Medicaid. It's too soon to know for sure, but if you have more people covered, the overall health is going to be better, the health of the pool is going to be better, and so it's pretty logical that rates will be more reasonable.
And just so all of our audience members here know, and as well as those at home know, and this is not, News 13 is not taking any positions on this, but I just want to share some information. According to an article published in the New England Journal of Medicine, the article was published in December of 2013. I'll read a quote. It says, an estimated 319,000 uninsured North Carolinians with annual incomes below the federal poverty level of $11,490 for an individual are ineligible for Medicaid because the state rejected the program expansion. These low-income people are also ineligible for subsidized coverage in the North Carolina exchange. So if these numbers are correct, according to this article, there are 319,000 North Carolinians who cannot qualify for Medicaid. And you want to follow up, Donald?
Yeah, I do want to follow up. She's right in that the insurance rates will adjust to whatever Medicaid is going to do in North Carolina over time. But we do know that the state of Oregon expanded Medicaid in 2008 to the levels that are now coming out under the Affordable Care Act. And a study that came out this past month from Harvard said that people who came in under the Medicaid expansion in Oregon were 40% more likely to opt for emergency care. Now, the idea of Medicaid is to provide preventive care, so people are not opting for the more expensive emergency care. Well, they're 40% more likely to opt for the more expensive care, which is emergency care. My guess would be that would increase insurance rates across the state if such a thing happened in North Carolina, and it's probably going to happen in Oregon.
Yes, thank you very much. Well, I know a lot of folks at home want to be a part of this important discussion, so let's go to our digital desk. Frank, what do you have for us?
Mark, the Facebook page has been blowing up. We've just taken a snap poll, and we have the results. This is to that question you asked at the beginning of the program. Do you agree with this statement? Americans have access to quality health care at affordable prices. And according to our this is a non-scientific snap poll of those people who responded. 54 said no, and 1 said yes. And I'll read to you just some of the comments that they posted along with those answers to the poll. Terry writes, less so with Obamacare. Pat says, not under the ACA. And we have a lot of no's listed here. Here's not with Obamacare from Sharon K. Cloud. And the strong survive from Damien. Now, we want to share with you a question that came in earlier this week from our website that somebody emailed us, and we want to put this up on the screen for you. And this question comes from Berlinda Deal, who is in Swannanoa. And she writes, why are federal employees in Congress exempt from this insurance coverage? Is it not good enough for them? Mark?
It's a great question. So let's go ahead and put it to Cody. So, I know I'm putting you on the spot, but there have been some either exemptions, or in the case of members of Congress, it's actually members of the executive branch, the White House, and members of Congress and staff are getting a subsidy not available to anyone else in America. What is your read on that?
My read is that Congress gets a lot of subsidies not available for the rest of America. And we're not sure why that happened. I do know that they now have to go on what's called the DC exchange. I know that they're not happy with it, and they realize that they're experiencing just a little bit of what the rest of America is experiencing because of them.
Leslie, any follow-up on that?
I think ditto. A lot of things happen in Congress. They get a lot of perks that we don't get, and I'm not sure why it happened. I think it needs to change. I think that everyone should, I think members of Congress and their staff should go on the exchange. I don't know why it happened.
And just a quick snap poll of my audience here by sound of applause. Does that make you angry that Congress and their staff and White House staff get subsidies available to no one else in America? Applaud if you are angry about that. Please step over here. Tell us who you are, where do you live, and what's on your mind.
Hello, my name is Linda Southard, and I live in Candler. And my question is, we have been told how we can go on these marketplace exchanges and we'll be able to compare plans and prices side by side. However, when you go on the North Carolina exchange, no offense to Blue Cross and Blue Shield, but pretty much that's the only choice you have. So my question is, why is that, and will that change?
Good question, Alec.
We are the only company that's covering all 100 counties in North Carolina. There is one other company, Coventry, that's covering 39 counties. 7 companies were approved to offer insurance on the exchange in North Carolina and declined to do so. One of the reasons, it could be the lack of Medicaid expansion. That what that means is there's a lot of people with lower incomes and higher health issues, and those companies didn't want to take them on. The fact that we're the only company that went to all 100 counties, I can't speak for the other companies. I can say that being a North Carolina-based company that wants to provide service to all of North Carolina, we felt that was our duty. But for the other 7 companies that are approved and decided not to move forward with that, I can't speak for why they didn't go ahead.
And before I follow up with Donald, just a quick data point so everyone understood this. In North Carolina, 39 counties, the people who go in the exchange have an option of selecting from 2 insurers. In the other 61 counties in North Carolina, they only have 1 insurer to pick from. North Carolina is not the only state like that. The state of New Hampshire, they only have 1 choice. In Alabama, 96% of the counties only have 1 choice. It varies across the country, but in many states, oftentimes the public only has 2 or even, in many cases, only 1 insurer to choose from. Donald, I want to follow up with you. How much does this complicate the process when there is not that choice available to the public?
Well, the beauty of the American marketplace is choice, is that companies can compete with each other, and then the only way they can compete for more customers is lower prices and better customer service. But with the regulations under the Affordable Care Act, companies, you heard him, 7 companies opted not to do it. The other company that's available in North Carolina is Coventry One. I believe the other company that initially accepted to be on the exchange was Carolina One Health or something like that. And then they were about to start the exchange, and then they said, no, we don't want any part of it. The idea of insurance is that you pay the insurance company, and they accept you on as an insured client due to the risk of you being healthy, and that they'll eventually pay out for your health, for your health care when you need it. These companies just don't want to take the risk, and they don't want to, the regulations combined with who they're being forced to take on, they just didn't want to take the risk, nor should they be forced to do anything, up to a certain point.
And before I go to this young lady for a question, I want to share with you just a recent poll that was taken here in North Carolina by the Public Policy Polling Organization on January 14th. And in terms of favorability or support of the Patient Protection or Affordable Care Act, or Obamacare, 38% of North Carolinians support Obamacare, 48% oppose. Let's go to this young lady. Please tell us who you are, where do you live, and what's on your mind.
My name is Janet Presson, and I live in Waynesville. I'm the owner of an agency that employs over 600 North Carolinians, and as soon as affordable health care was passed, our health insurance rates went up 24% in 2011, 35% in 2012, and we were told they're going up 26% in 2013. That's an 85% increase in 3 years. I don't want to point any fingers, but our gentleman from Blue Cross could probably answer this question. What's going to happen in the next 3 years? Are we going to see another 85% increase? Because we were paying half and our employees were paying half. We can't afford those increases. Our employees can't afford that increase. And then the other prong of the question is, if we're all being forced into affordable health care, the IRS and other government folks are going to be deciding what we get and what we don't get. Are we going to next be forced into forced vaccinations, mandatory mental health screenings, things like that? I mean, healthcare workers are already being forced to have mandatory flu vaccines. Is it going to be restaurant workers next, teachers next? We're going to lose, I'm really afraid we're going to lose say in our health care, and I'm also an RN, and I don't like that. So, I mean, somebody can answer about the rates continuing to increase, and then about us losing our right to decide what we want and what we don't want for our health care, because I think we're really going to lose that.
And you said you didn't want to point fingers, but let the record reflect you did.
I had to.
You
He's
did.
There.
Okay. And so Alec, let's talk about the rate increase, because certainly I would think the insurer would be sensitive to that for a number of reasons. But can you talk about the rate increases and what you've seen?
Sure. Let me start off by saying I concentrate on the individual market, not the group market. So I'm going to try to give you the best answer based on my knowledge base on that. There's a number of additional benefits that all plans have to cover now. These are known as essential health benefits. So there's a number of things that previously were not covered or that you could pay extra to have covered. They were known as riders previously, things such as maternity, additional mental health services, things like that. Moving forward, all plans have to cover at a minimum level these 10 essential health benefits. What that means is that a number of plans that were under those minimum levels had to suddenly raise up their benefits pretty significantly, which caused the rates to go up to cover those additional services. If it's going to be the case moving forward, the goal was, and the idea was, that there would be a big bump initially as all these added benefits came into play. But once you got everyone into the system, once you had the healthy people in there as well, not just those that needed the insurance, but everyone in the system, that the increases would either level out or over time go down. Now that's something that it's long term. This law is very complicated. There's a lot of different moving parts on this. So until it plays out for a few years, there's no way to know what is going to happen. If it works out like they hoped when they wrote the law, then yes, the rate increases should not continue as they have. But until we see what happens with the market and who joins on these plans, it's going to be impossible to say.
I want to follow up with Cody on this for a moment. And just again, News 13 is not taking a position in this debate. However, in our research, we found here's one example that this is something that this young lady addressed. If you take a look at individual policies, if a single man purchased an individual policy, he must have in his policy anemia screening for pregnant women, breast cancer screening for women, breastfeeding counseling, cervical cancer screening, 13 more female-only procedures, and 6 child or newborn-only procedures. So, Cody, does it make sense that we would require someone who clearly perhaps would never use those services to purchase them? Or is it really just what insurance is all about, and they have to have everything?
I don't believe it makes sense. The hospitals in North Carolina employ 192+ thousand people. We have to have the same requirements for our employees as well. It makes more sense to give employees and all of us the options of those additional services, because we noticed when we required healthy middle-aged men to have maternity coverage, everybody's policy went up, when middle-aged men have never, ever, ever needed maternity coverage. So, no, I don't think that's reasonable.
Leslie, I saw you shaking your head. Did you want to weigh in on this?
What I do want to say is I don't think you're going to lose your health care rights, your rights to decide. Sometimes, yeah, if you're working as a nurse and you haven't had a flu vaccine, you can not only get the flu but spread it to your patients. It's a matter of safety. It's not a matter of, oh, I don't want that. It's a matter of if you can spread an illness that could be fatal to your patients, then you need to have that vaccine. And if you don't want to have that vaccine, this is what's called a right to work state, which means you really don't have a right to work.
But then you start with all the different vaccines, and you have to get them every year. And a lot of these vaccines are not safe and they're not effective. Most of the vaccines given in this country contain either formaldehyde or formalin, which is a known carcinogen. Then you wonder why so many people have cancer. Many of them also contain neurotoxins such as aluminum or mercury.
We have to address that. We have to address that.
And then, okay, it's just healthcare workers now, which is wrong. And some states are not giving any exemptions. Some hospitals are not giving any exemptions, even for medical and religious reasons, which again is wrong. We're losing our rights bit by bit by bit. It's like duck bites. And then all of a sudden, then it's going to be teachers because they can spread diseases. And then it's going to be people that work in stores and people that work in grocery stores. And then it's all of us, and they're going to line us all up every year.
All right, and let me go ahead and bring Donald into this discussion. So her concern is, and that was the second part of her question is, she's arguing that there's a loss of the freedom to choose by people. Is that a legitimate concern?
Absolutely, it's a legitimate concern. It all dials back to the individual mandate under the Affordable Care Act, and other nations have implemented an individual mandate, and if we're going to have one, we should look to the models that have actually worked in other countries. I'm not saying I endorse the individual mandate. I think it's terrible to require individuals to purchase something under penalty of law. But if we're going to do it, Switzerland and Singapore have both had great success with an individual mandate. It only required that they have the catastrophic coverage, and healthcare costs as part of the GDP in both of those countries have gone down. And in Switzerland in particular, it's really worked. The percentage of GDP is similar to what it was in the United States. It was about 15%. They've gone down to around 7 or 8% at this point. They're about the size of the state of Massachusetts, which has 3 insurance companies now. The nation of Switzerland now has 54 insurance companies who are all competing for a very minimal synthetic marketplace, and they can only compete with each other with better customer service and lower prices, and that's what we've seen in Switzerland.
And before I go back, follow up, just one more thing with Alec. We have so many insurance companies in this country, big and small. Why is it there are so few choices in each state?
Part of the reason is you can only sell within the state as far as the individual policies go. You can only sell in the state where you're located. So, for example, Blue Cross and Blue Shield of North Carolina can't sell policies to people in South Carolina. We can't sell policies to people in Virginia. So we're limited by geographic regions. The other reason is some companies don't want to go into certain states based on the health of the state, based on the size or their capacity to handle a certain number of people. They're going to concentrate on only certain markets. So those 2 factors play a role. With group policies, it's a little different. You can sell group policies because companies do have offices all over the country. Group policies can cover people throughout the country. So you can see more competition in that.
And that's a federal prohibition that doesn't allow selling of insurance health insurance across state lines.
Correct.
In your opinion, if that law was changed, would it be positive for the consumer?
Yeah, honestly, I don't know. I think that it could be by giving them more options. I think there's a number of different plans that come in. I think we're a great company. I think we do very well outside of North Carolina. But if it would make a significant difference in options or price, I can't say I wouldn't.
I see Cody shaking his head, so he believes it does.
I do. I think if you look at the economics and going back to having a broader pool, if a company is able to have not just North Carolina in their pool, but the entire Southeast if they choose. I believe that'll lower our insurance rates and give us more access because it'll increase the amount of healthy people that an insurance company could have in their pool.
All right, now the control room tells me a lot of people are really weighing in on this issue on Facebook and Twitter. Before we go back to Frank and the digital desk, I want to get one more question in from our audience. Please tell us who you are, where do you live, and what's on your mind?
Sure, I'm Nancy McDonald, and I live in Hendersonville. And I have a simple question. I've gone to the website a couple of times, and I had questions while I was trying to enroll, and I wasn't sure who I could talk to help me through the enrollment process with my questions.
All right, and just before we get to the panel, by a sound of applause, how many navigators do we have in the room tonight? Okay, so even if we don't get a question from the panel answer your question, I think we may have one or two people here who can help you before the night's over, okay?
Thank you.
Let's go to the panel. So you've clapped, Leslie. You're a navigator.
Yes, I am.
How does someone like this get assistance?
There is a number you can call. I'm really bad at memorizing numbers, but it's out there on the table. Susan, you've got some of those papers left, I think, that have the number. There's one number. It's a toll-free number that you can call, and the person there will direct you to an agency that has navigators in an area where you live, in your county. So it's one number. You can call it. They'll direct you to the agency. You call the agency, and you've got a navigator.
And if you have questions, News 13 will find the answers for you. But I'll tell you, it would be great if any of those navigators could speak with this young lady afterwards. Perhaps you might be able to answer some of her questions before she leaves tonight. But a lot of folks at home have questions, so let's go to our digital desk. Frank, what do you have for us?
Well, Mark, you are absolutely right about people wanting to weigh in. We have over 500 posts now on our Facebook page. I'm going to share a couple of those with you, as well as what we're getting on Twitter right now. On Facebook, Ashley Moore Priest writes about whether or not we have affordable health care. She says, no. This time last year, my husband and I were paying $56 a month for the best plan Cigna had. Now we had to go with BCBS and having to pay $482.49 a month for the lowest amount of coverage. We have to choose between health care or paying our rent. Healthcare won. Another comment comes in from David Joe Miller. There is no such thing as quality health care at affordable prices. It's not Obama. We didn't have it during the Bush dynasty or Clinton era. Healthcare needs to be overhauled. ACA is nowhere near perfect, but it's a start in the right direction. It's going to be painful, but in the end, when the dust settles and tempers ease off a bit, I truly think they'll be able to shape it up into something doable for all. Now let's take a look at what's coming in on Twitter right now. We're getting some questions there as well. And one of them is from Ashley Ann Larson. She says, to Leslie, 99% of the premiums exceed the total income that people receive. We've got some other comments there, but I want to show on the screen a couple of comments that came in to our website. This one comes from Tammy Blevins. My employer will be freezing our paid time off accrual and giving no raise this year because of it. Yeah, I love it. And also, Robbie Brackett writes, people need to read the law. Don't go by what people tell you, and educate yourself on what is truly happening. We also have a question from Twitter, and this is from Joe Stafford. And he posted in our town hall at hashtag WLOS Town Hall. And he writes, my wife is on Medicare. Do I have to include her income when trying to figure out coverage?
What a great question. Alec, are you familiar with this issue?
So when you're putting your income, they want your modified adjusted gross income for the entire household. So whoever's on your income tax form. Now, modified adjusted gross income has a few differences from your standard gross income. So if she's on Medicare, it depends what income sources she has. Things like Social Security, if she has a pension plan or retirement plan, there could be some things that go towards that modified adjusted gross income. What they can do is they can speak with a navigator, they can speak with us, and we can help, based on their situation, help them figure out what would be the correct answer for that.
Quick follow-up. If they file separately as individuals as opposed to married couples, does it make a difference?
Yeah, it makes a very big difference. If you're married and you file separately, you automatically exclude yourself from getting subsidies to help pay for your insurance. So even if you qualify for subsidies, if you file separately, you cannot get those subsidies.
Very good. Thank you very much. And before we go to this young lady, I have another snap poll question. I'd like you to respond with the sound of applause. Your two choices and answers are yes and no. Do you agree with this statement? Government mandates are the best way to maximize consumer health care choices. Those who believe yes, please applaud. Those who believe no, please applaud. Let's go to this young lady. Step over here, please. Tell me who you are, where do you live, and what's on your mind.
Okay, I'm Carolyn Camo. I live in Weaverville, and my story is that on Saturday, this coming Saturday, I'll be 7 years out from a stage 3 breast cancer diagnosis.
And you're
Thank you.
cancer-free today.
Yes, sir.
Very good.
Thank
Thank
you.
you.
Thank you. And my experience, I think it's great that we're all coming here and talking about our experiences. I felt, unlike some other people who have commented, very unsafe for the last 6 years because my treatment happened at the same time my husband got laid off. He worked in the construction and building field, and it was very hard hit in 2007 and 2008. I went through my treatment. We lost our insurance in the middle of my treatment, and I got on the high-risk pool after I went to a large insurer and learned that it would be over $3,000 a month just for me. My kids are now on Medicaid. My husband has been uninsured, and I was in the high-risk pool at a high rate per month. And also, it didn't cover anything. So my doctors didn't participate in it. There was a lot of problems, and we paid for almost everything out of pocket. Almost half our income one year went for my health care. So I signed up with the Affordable Care Act, went on the phone, and I burst into tears when she said, nobody can discriminate against you anymore because you have a pre-existing condition. So I am making a comment, and my question is somewhat dramatic, but it's real. How many more times are we going to have to walk into grocery stores and convenience stores and see jars? This disease-stricken person, please give. It's just not how things are supposed to be, and I agree, we have to start somewhere. And there was violent opposition to things we consider wonderful now, like Medicare and Social Security.
So Leslie, are we making progress? Are we moving in the right direction? Or
we are. It's not perfect. And, you know, I would have liked to see a public option where I can buy into Medicare. I would have liked that choice because the insurance companies do have a virtual monopoly in this country. They're exempt from antitrust laws. And the only way to get real competition is either unexempt them from the laws or institute a public option where we can buy into Medicare if we so desire, or we can choose a private insurer. I think that's where we need to go. But this is such a big step. My son would have survived had he been alive for the Affordable Care Act. He wouldn't have been denied insurance and then denied care. No, it's not perfect, but it's a great step ahead of where we've been.
I want to follow up with Donald. Do you agree with what Leslie said, or do you have some other issues that you want to address?
I think what Leslie said was with the insurance companies that we need to either unexempt them or create another monopoly through a government public option, which I don't think that's the way we want to go either. I don't think anybody will say that what we had before the Affordable Care Act was a perfect health care system. It had a lot of problems, and I don't think it needs reform. I don't think that the Affordable Care Act is the way we need to go. There are some things that can be done at the state level, such as reforming certificate of need laws reforming certificate of need laws and allowing other private entities to get into the marketplace, such as church clinics and free clinics, and allowing other doctors to just open up a free clinic if they want to. I think that will provide affordable health care to a lot of people, and that's one of the few basic reforms that we can do at the state level, along with allowing insurance companies to sell insurance across state lines.
Now, before we get to this gentleman's question, I'm going to make things a little more difficult for Cody. I know you're on the hospital side, but this is a second part of what you do. I want to share some statistics with everyone here. According to the Association of American Medical Colleges, we're going to face a 91,000 doctor shortage over the next 10 years in America, 45,000 primary care doctors, and 46,000 surgeons and medical specialists. And we continue to have this phenomenal growth in people aged 65 and older, so people who tend to need more medical care. So can you talk for a moment about the strain that puts on hospitals and healthcare in general when we may have the bricks and mortar in the buildings, but we don't have the doctors?
It is something that we are extremely concerned about right now. Most of the medical students who graduate right now go into specialties. We need specialists, but more than that, we need some primary care doctors. One of the biggest concerns with Medicaid expansion is we didn't have enough doctors to cover it. That was just one of the small concerns. We are trying to do everything we can to make sure that we have the doctors in our state that we need to care for our population, aging or not. One of the reasons that many of your hospitals will buy a practice is because it's either the doctor leaves or we buy the practice so that they can see patients as opposed to doing the paperwork that's required to stay open. So we're very concerned about the doctor shortage, and we're doing everything on the hospital side that we can to make sure that we have enough doctors in our state, but it's not easy.
And one quick follow-up so everyone appreciates how difficult the situation is. According to the Doctor Patient Medical Association Foundation survey conducted in May of 2012, they asked doctors, how do current changes in the medical system affect your desire to practice medicine? 5% said, I'm re-energized. 13% said, I'm unsure, I have no opinion. And 83% said, it makes me think about quitting. Let's go to this gentleman. Please tell us who you are, where you live, and what's on your mind.
My name is Scott Parker, and I'm from Asheville. And I'd like to make a quick comment first. I work at a community health center in Asheville, Western North Carolina Community Health Services. We're signing people up or assisting them with their sign-up process at our health center. Our sister health center, Blue Ridge Community Health Services in Hendersonville, is doing the same. So I just want to let you know the community health centers are another source if you do want to try to get some assistance in signing up for the marketplace. But I read an interesting article last week, and that showed that North Carolina ranked number 3 in the total number of sign-ups among the 35 states in the country that are in the federally facilitated marketplace. And I wanted to ask our panelists, what do you attribute that to? Why would North Carolina, if only 38% of the population in our state think the Affordable Care Act is a good thing, why do we have so many people signing up in North Carolina?
Leslie, what do you think?
I think people are actually excited about being able to get coverage. My son would have been thrilled to get coverage, and even if you don't think the law is the best thing, I think people are excited at being able to get coverage. And we'll see how it plays out, but I think part of it also is that here in North Carolina, we've made a great effort in educating people, and I think we've done a really good job of letting people know that the exchanges are there, that they can sign up, that we have navigators. Blue Cross Blue Shield is out educating people and signing them up. I think we've just got a really good education going on here in North Carolina. And remarkably, none of the 3 states that lead in sign-ups are expanding Medicaid.
And just in a quick follow-up to that, Elon University had a poll conducted November 15th through 18th of 2013, and it asked the public to rank in order what were the most important issues. Coming in at number 1 was health care and the Affordable Care Act at 24.4%. Let's go to this young lady. Please tell us who you are, where do you live, and what's on your mind.
My name is Martha Sachs. I live in Hendersonville. And I, first of all, want to clear up something, an impression that people have all the time when they keep talking about government-controlled health care. I've been on Medicare for many, many years, and nobody tells me what doctor I can see. I can go to any doctor I want to. I do not need a referral as long as the doctor is willing to accept Medicare. People don't understand this. They think government controls it. What is really controlling health care is the private insurers who tell you you can only see doctors that are on this panel, and you have to get approval before you can see a specialist, and sometimes we don't let you go to them. So I think people have a very bad impression about what's really going on, and they need to understand it more readily. Another thing I'm concerned about is that I think that the Affordable Health Care Act is a step in the right direction, but it happened as a result of an attempt to try to compromise with the insurance companies, instead of going directly to what they should have done, which is a single payer system like Medicare for everybody. Because with Medicare for everybody, and I have a Medigap policy, but the whole thing, my monthly premiums of both put together are just a little bit now, and I'm very, very old.
No, you're not. You're not.
I'll be 87 in April.
Kind of old.
That's not old, though. And you're going to be with us for a long, long time. We'll be talking about this years from now.
I hope so. But my point here is that if everybody had this, and the Medigap policy is not that expensive, my whole thing with all of this, and at my age, is still under $300 a month. And I've had surgeries for which I have not had to pay anything out of pocket.
All right. So this young lady made some good points. But, Donald, are there aspects about Medicare that we should be concerned about? Because the Medicare trustees have given some warnings, haven't they?
Well, yeah. I can't speak about Medicare as well because a lot of the Affordable Care Act stuff has really come down on the Medicaid side. But she makes a point that she can go to any doctor that she wants, and she can. Medicare, doctors are much more willing to accept Medicare. But when you go to Medicaid, you find a lot more doctors and clinics are less willing to accept Medicaid, which does limit how many people you can go to. There are payment problems with Medicaid. The rates are back, and it ends up as a net loss to the doctor. Doctors do a lot of good, and they're not there to cause any harm. They're there to help their patients, but they're also there as a professional trying to make a living. And they shouldn't be forced into having to take on a system that pays them less than the services they've rendered.
And I know you have a quick follow-up.
Yeah, one of the biggest costs I've heard there's been a huge increase in the cost of medical care over the last 4 years. One of the biggest costs, if not the biggest cost, has been the cost of medication, which has been rising outrageously. The other thing that I'd like to know is why nobody is doing anything about the severe over-medication that is going on, not just in long-term care facilities and hospitals, but with people in general, and especially in those cases where in these cases where they are over-medicated, the doctors who are doing this over-medication have financial connections to the special pharmacies that only supply long-term care in hospitals. This is a conflict of interest. There should be a law against it, and there isn't. I've called the Inspector General of Kathleen Sebelius' office to talk about this, and they said they can't do anything because the law says they cannot interfere.
All right. Well, let me follow up with this. Alec, does Blue Cross Blue Shield have any kind of policies regarding just conflict of interest in general regarding any of your practitioners?
As far as the practitioners having
any business
contracts
relationships with referrals or medication or anything? Broad question.
With the contracts that we have with the doctors, I'm not familiar with that part of it. I can say that we always try to negotiate the best rates we can for both medication and with the doctors themselves, but the doctors with pharmacy companies, I don't know what the contracts stipulate as far as that is concerned.
Okay, and I want to just do a quick follow-up, and again, News 13 just sharing information. While every poll shows that Medicare recipients are very happy with Medicare, there are some concerns according to the Medicare trustees, and according to their 2012 Medicare Fiscal Health Report, there's an unfunded liability of $38.6 trillion over the next 75 years, and there are concerns at the current rate that Medicare will go bankrupt before we can take care of all of our outstanding debts and concerns. So there are some issues over the horizon. Let's go to this gentleman. Please tell us who you are, where you live, and what's on your mind.
My name is Bruce Joba. I'm from Etowah, and I retired down here in 2005 from Western New York. I worked for a large photographic firm in Western New York. It will remain unnamed. And they filed bankruptcy in 2011, and in 2012 they announced they were going to take health care away from the retirees. So in 2013, I had to pay the full shot for health care for my wife and myself. I'm a legacy customer of Blue Cross Blue Shield. I went to your presentation at Biltmore Park in September. I was able to get on the healthcare marketplace in mid-November, successfully applied, and I qualified for the premium tax credit. But it's taken me 5 weeks to finally get my new insurance card and new policy, and I was wondering if this is a common problem with Blue Cross Blue Shield and the exchange, and what's being done to correct it.
What do you think, Leslie? Are you familiar with this?
I've heard about it. I've heard that, you know, it was overwhelming for some people. There have been some computer problems. There have, you know, but it is evening out. It's shaking itself out, and it's getting better. You know, whenever you launch something as massive as healthcare reform, there's going to be bugs, and this was one of them. And from what I understand, it is shaking itself out pretty well.
Quick follow-up with Alec.
First off, let me start off by apologizing. We know that this has been complicated, and it was overwhelming for a time. Right around mid-December, the system, the marketplace finally started working at a much better rate than it was before. So we had a massive influx of applications. And then there's a communication between the government and our site, and there's always hiccups with that. We've been working overtime. Our staff is working until midnight most days, Saturdays as well. So we're trying to get this resolved as soon as possible. It's complicated, it's new. We're trying to do the best we can with that, but there are going to be hiccups at times, but we do think we have a handle on it now, so the turnaround time has been reduced significantly.
Sir, please step over here. Tell me who you are, where do you live, and what's on your mind?
I'm Stuart Engel. I live in Asheville, and I'm an independent insurance broker. Have been for 14 years here in Asheville, and I've definitely seen a lot of changes over 14 years. I wanted to just touch base on just a couple things real quick here that have been tossed about in this room. It's been my experience that I've seen a lot of people paralyzed with fear in regards to healthcare reform and what is happening. First off, we've touched on a couple different things tonight, and you've got to keep in perspective individual insurance versus group insurance. They're two different things. And there are options out there with ACA that I've never had in 14 years of being a broker. So I think that there are really good choices for people, but you should not do it alone. I think that healthcare.gov is applicable for people that are between the 100 and the 400% federal poverty level. If you're not in there and don't qualify for a subsidy, then you can go direct and still apply for an ACA compliant plan and end up in a better light than you think that you are. And when you're talking with group in your situation, there's private exchanges which have not even been touched on here. For example, the town of Matthews went on a total private exchange, saved millions of dollars, and everybody in the town of Matthews who are employed there got to pick their own plan, while the entire town saved millions. So I just wanted to touch on the fact that there are a lot of options, but you're not going to find them on your own without a licensed broker, which brings me to the question. Why do we have licensed brokers versus navigators now in this whole system? It's my understanding that a navigator doesn't carry an insurance license, where folks like some of the other folks that are in this room here have gone to school, have been accredited with the state with a license. So how and why does that exist?
And before we get an answer up there, you said it was a lot of fear. Is it fair to say it's fear of the unknown because people just don't understand the information? It's that complex. Is that fair?
Yes, that's fair. People do not understand. I mean, people don't understand the basics between group and individual insurance. Right off the bat right there, and all the way down the line. You should not do this without a licensed professional. That's why we carry a state license.
Cody, how do we make it easier? Can we make it easier? Can we make it more understandable? Or is it just too complex and too complicated that it's always going to be a challenge?
Healthcare is very complex. We've gotten a system that has for decades developed into what it is. I think it both can work equally. The navigators are volunteers, I believe, yes, who are there to help with the basic enrollments in the ACA. I think our brokers are definitely necessary. And for those that can't afford insurance, they should all know that their hospitals are willing to work with them on whatever they need. You know, it's not necessarily going to be free, but some of our hospitals do have really generous charity care policies. So if you can't get on and you need help immediately, your hospital is there to help you.
And I don't want to keep going back to the well all the time, but did you want to weigh in on this quickly, Alec?
Well, I'd say that navigators play a crucial role because a lot of people want an unbiased opinion. And sometimes they feel if they go to an agent or directly to a company that we're going to steer them towards a particular product. So navigators do play that role. Going back to the other point, since July, as this gentleman mentioned, he saw us at a meeting back in September. Since July, we've been running events constantly because that is probably the biggest problem. People are confused, and when people are confused, when they don't know, they get scared, and it causes a lot more angst than it needs to. So we've been actively going out in every community we can to try and explain it. Not all of it is easy. It is very complicated in a lot of areas, but the basics of it are pretty straightforward, but sometimes you need someone there to help you understand what you're looking at.
And just a quick follow-up with Leslie, even though the individual navigators are volunteers, the Department of Health and Human Services gave 105 different groups $67 million to work the Navigator program. Do you have any idea where that money was being spent or how it's being spent?
It pays for training. It pays for administration. You don't just say, all right, we're going to train X number of navigators and it doesn't cost anything. When you think about the number of navigators who've been trained for that money, it really is a bargain.
Very good. Thank you very much for the information. And we're going to get back to our viewers at home in just a moment, but I want to get one more question in. Sir, please tell us who you are, where do you live, and what's on your mind?
Hello, my name is David Rode, and just to give a little bit of background information, I'm the chairman of Henderson County Teenage Republicans. I know I may not be the most liked person in the room right now, but I think
we love you. You're doing a great job.
I think it's important for youth to have a voice. I agree. Me personally, I know that healthcare system is broken. I think we can all agree upon that. Excuse me. And I mean, I would like to think this is our country. We vote these people into office. How come we can't fix this ourselves, regardless of political affiliation? Because I mean, we're all beating each other up and not getting anywhere, and I don't like it. I agree. It's not good for the country. It's not good for us, and it just makes us look bad.
That sounds like an applause line to me.
I think so.
Well, my question to everyone in here and to the panel as well is, I've always thought, what can I do and what do I think if I had any power to adjust something in this law? What do you think could be tweaked to make this a better law? How can we make it a better law? How can we make it work? Personally, I think that the law in the current state is not the best idea. But again, as I said, I believe that the system is broken. It needs to be fixed. I just don't think this is the right way to do it. So that's my question.
All right, well, I want to go to Donald with this. And by the way, he made a comment about, well, politics. Is this 2 parts policy and 1 part politics? Is that part of what's going on here? And then how would we fix this if we could?
Yeah, no, it's absolutely policy and politics. Of course, my side is advocating for the full repeal of the Affordable Care Act. I mean, that's just where we are on this. And then, you also have Republicans and Democrats just wailing on each other. Republicans think, Democrats are trying to take over the country with take over health care, and we're going to have death panels and things like that. And Democrats think that Republicans are trying to let everybody die on the roadside. Obviously, those are 2 extremes, and neither of them really get to where we can fix health care. One way that this law could be fixed or be made better is actually advocated in the new health care plan put out by Senators Burr, Hatch, and Orrin. Senator Richard Burr here in North Carolina signed on with it. And what that law does, it's sort of a fix to the Affordable Care Act. And one major thing that it does that we really like is that it block grants Medicaid. The states have been sort of treated as an administrative arm of the federal government in administering Medicaid. They can't really do anything. They are given the money, they pay it out in the Medicaid program, but they can't really change or innovate how it's paid out or how the program's run or anything like that. In 2009, Rhode Island was given a special waiver on Medicaid, and they were block-granted Medicaid. They were just given a huge pile of money for all the Medicaid people in there, but they could innovate in how it was paid out and how the system was managed. In the first year alone, they were able to innovate and find new ways to manage the system, and they saved $100 million a year in the tiny state of Rhode Island. I can imagine we can do just as well, if not better, in North Carolina if Medicaid was block granted and given 1 chunk of money and allow the state to better manage it rather than just be an administrative arm of the federal government.
Well, let's go back to the original question. What would be some of the ways you would think the law could be improved? Do you have any suggestions?
Well, I still think there should be that public option to let somebody buy into Medicaid, the government's very popular Medicare rather. The government's very popular single-payer system. In Australia, I have a friend who lives there. She said, boy, I wish I could afford private insurance, but I sure am glad I have the government insurance because it saved my daughter's life. I paid $50 for her surgery, and $40 of that was parking. It's important to give people that option. And, so you don't get the bells and whistles. You have a semi-private room instead of a private room, but you don't die the way my son did. If you want bells and whistles, like in Australia or even in Canada, you can go to a private insurer and you can buy insurance that gives you that private room with cable television, phone service, and a better menu. But you don't die. Before the Affordable Care Act took effect, 45,000 Americans died every year, 1 every 12 minutes, because they couldn't get health care. Wouldn't you prefer to be able to buy into Medicare and get something rather than be told, I'm sorry, you have to pay cash up front or die? And that has happened. It happened to my son.
Your friend in Australia needs to pick a better parking garage.
Yeah.
A lot of folks at home want to join this discussion, so let's go to our digital desk. Frank, what do you have for us?
Well, Mark, we're hearing a lot on that last question you posed to folks about whether or not the government mandates are the best way to maximize consumer health care choices. And I want to share some of those comments with you. But first, I want to remind folks at home that they can get involved with the town hall. They can do that at facebook.com/news13, or they can do it at Twitter at WLOS_13, and also at the hashtag WLOS Town Hall. Now, let's take a look at some of the comments we're getting from our Facebook page. And this is regarding that question about government mandates. And Karen writes, no, my freedom means more. And then we get a comment from Junior, and he writes, yes, plenty of successful examples throughout the developed world. Now, I want to turn over here to Twitter, where Philip Gregg added a comment. My sister tried to get coverage through the federal system and was denied. They wouldn't even tell her why, just said appeal. And AFPNC posted this comment, Medicaid surgical patients are 13% more likely to die than those without any insurance at all. So those are some of the comments we're getting, and I want to share the snap poll with you about that question. When you asked, do you agree government mandates are the best way to maximize consumer health care choices, 67 of the people so far that responded with an answer said no, 3 said yes. We've had over 850 comments on that question. Now I want to leave you with this last question, if we can bring it up on the screen. Why, and this is from Roy Jensen and Fletcher, why is everything in the Affordable Care Act age dependent? Fees, services, medications.
Can you repeat that last part?
Why is it that everything in the Affordable Care Act is age dependent? Fees, services, and medications.
Alec, is the Affordable Care Act age dependent?
So, insurance plans are based on age. The older you are, the more expensive the plan is. Now, with the Affordable Care Act, it's shrunk the difference between the lowest cost, so someone who's young and very good health, and someone who's older. It's shrunk that difference between the plans. But the other part of the question, services and medication, I've never heard of someone going into a pharmacy and paying more for drugs because they're older or paying less because they're younger. I think that would be illegal or unethical at a minimum, and I've never heard of anything like that. So I can say that the cost of the plans can vary, but the subsidies, if you qualify for a subsidy, increase as you get older to offset the higher cost of the plan itself.
You wanted to weigh in on this, Cody?
I was just going to agree. I don't believe that those age variances are in there at all. So,
all right. And now we're under 30 minutes for the rest of this discussion tonight, so we're going to get into the lightning round. So I'm going to ask for questions just a little tighter, a little shorter, answers a little shorter, because I want to get as many questions in as possible. Sir, please step up with me. Please tell us who you are, where do you live, and what's on your mind.
I'm Skip Edwards, and I live in East Asheville. I'm 64, my wife is 63, and we are absolutely benefiting from the Affordable Care Act. For the last 3 years of our life, our number one worry and concern was insurance, because we both have pre-existing conditions. However, January 1st, we have a policy, a gold level, if you've been to the healthcare.gov, and we are saving $500 a month through the subsidy tax credit. Makes a huge difference in my life. I'm sure it would for most people. My question is, I want to shift the dialogue or the discussion to more on a moral level. And I find that access to health care is a moral right. And I find it greatly offensive. Donald, your organization and the Republican Party opposes it on some vague thing of the free market and people should have more choice. That's great if you got the access. But if you don't have the access, you're screwed. And when the gentleman talks about he's alive today because of care and insurance, a survivor of cancer, who and what families are exempt from health care problems and crisis? It stops the world for where you are. So I just want to know, especially you, Donald, what moral right do you pretend to have to deny access to millions of people across this country?
Well, Donald, I think that question was sent your way.
I don't propose to deny anybody access to health care. That's one of the things that Americans for Prosperity advocates for is amending state certificate of needs laws. Let's be clear on what this law is. It is where the state government, you have to go in, if you want to open up a hospital or a clinic or any type of medical facility, you have to go before a board of the state government, and they have to tell you if there is a need for that facility or not in that state. 36 states have these laws. Now, what that does is that it limits the amount of competition that can be in the marketplace. So if I'm a doctor and I want to open up a clinic here, I have to go to the state board and they can tell me yes or no, and then I have to appeal it if they say no, that I can open a clinic. The basic laws of supply and demand means that if there's more supply of medical care in a place, then all they can do is try to drive down costs in order to compete for more customers. This type of law is crony capitalism at its finest, and that is one of the reasons why healthcare costs have continued to go up. It's a way that we believe that health care can be more accessible for people. We oppose this law on the fact that we think that it forces a lot of people into things that they don't want. It's literally, it's run by their taxes. If you don't pay your taxes, if you don't pay the tax penalty, then you can be jailed and fined by the federal government. We think that that is immoral. We're not trying to deny people any access to health care, and I think that accusing us of that is sort of morally reprehensible in and of itself. But what we want is more access, and we think that health care needs to be reformed, but in a much different way than the Affordable Health Care Act is doing it.
Okay, and I'm going to have to continue on with the lightning round here because we're running out of time, so I want to get as many questions and answers in as possible. Please step up. Please tell me who you are, where you're from, what's on your mind.
My name is Milton Butterworth. I work with Blue Ridge Community Health Services. We're a community health center like Scott's organization in Asheville. We're in Hendersonville, and I agree with a lot of the things that have been said in terms of, it's not a perfect law. I think it's something that we can all work on and make better over the years. But I do want to give everybody kind of a little bit of a positive feel in the time that we've been working with the public and trying to...
It better be a short positive feel because I'm running low on time.
Okay, great. We basically have helped over 3,800 people understand the Health Care Act a little bit better.
Your navigators?
Yes.
Okay.
And over 400 have actually completed an application. And so there's a lot of positive signs for the 13,000 uninsured people that we serve every year.
Very good.
That's it.
All right. Thank you very much. And I had this gentleman step on over here, please. And we're getting through as many questions as possible. Please tell us who you are, where do you live, and what's on your mind.
I'm David Trout. I live in Weaverville, and like my friend Russell and many of the navigators here, I'm involved in this. I'm an independent agent. And I just wanted the panel to address the urgency of March 31st, the end of open enrollment, and what that really means for folks.
Leslie, March 31st, what's that date mean, and what's the significance for people in this room?
It means that open enrollment is over. And unless something in your life changes, there will be a 6-week open enrollment period every year. And you can always sign on during that, but not outside of that unless you've lost a job or lost insurance or there's been another change in your life that will allow you to enroll. So you really want to enroll by March 31st. It's really, really important.
Anything you want to add to that, Alec, or is that good?
Yeah, I think there was a lot of press right up to December 31st. A lot of people assumed that was the end of it, but it actually goes till March 31st. Also, it's your last day to get insurance, and if you don't get it by then, you're going to face the penalty that we've discussed with the mandate, the tax penalty for not having insurance. So you want to make sure that you get it done by March 31st to avoid that.
All right, we're back to the audience. Sir, please tell me who you are. I've got this. This is my job here.
Mike Meehan, Oldport.
And your question is?
I actually have a quick comment and a question. Referring to the $65 a month Cigna plan that woman lost and was talked into a multi-$100 plan, there was a profile on CBS not too long ago, a couple months, with a woman who had a $54 a month Blue Cross Go Blue Plan 91 and a $54 a month that really gave her nothing, and was talked into a $591 plan by Blue Cross. Somebody saw that, went through the Affordable Care Act with her. She now has a silver plan with one of the three major insurance companies that with her $320 a month subsidy, she's paying $165 a month and actually has insurance. The question I have is this. It's my understanding that with respect to the nurse's comment about premiums, that insurance companies cannot raise premiums by more than 10% a year without getting pre-clearance from the state. Is that not true?
Any premium increases always has to be approved by the state. In North Carolina, we always have to go to the Department of Insurance with whatever rate increase we want, and they look at the books and decide if they'll approve that rate increase. If they don't, then they determine what they feel is an appropriate rate increase. So that's the way we've operated for years and years.
Please step up with me. Please tell me who you are, where you live, and what's on your mind.
Hi, I'm Jackie Kiger. I live here in Asheville. I'm a certified navigator with Pisgah Legal Services, and so I just wanted to make a really brief comment just to let people know that Pisgah Legal Services here in Asheville, as well as the Council on Aging of Buncombe County, are navigator organizations. We have staff and volunteer navigators who are available to provide information and support to those who want information about this. We also recognize the excellent work that the brokers and agents are doing, and so we're just another resource that's available. And we do have a toll-free state number that people can call to get assistance.
And that number is?
Can I give that number?
Absolutely.
Great. So for those who are hearing at home, it's 1-855-733-3711.
That's the one I was talking about.
So feel free to call us, and we can help you if you've got some questions.
Thank you very much.
Thank you.
You know I want to get back to our social media because there are a lot of folks at home who want to weigh in on this, and we've been blowing up all evening on with both Facebook and Twitter. So let's go back to our digital desk and see what Frank has for us.
Well, Mark, so far we've had over 1,300 people get involved through Facebook and Twitter, and these are some of the comments that we're getting about that question. This is Travis Cagle, and he says, yes. Government mandates okay. Guess I can tell who votes for who. Of course, this thing is confusing to a lot of people. Yes, if you're in it for higher government, is what Chris Galloway writes. And if we look over here at Twitter, completing an application and actually having health coverage are two completely different things. And Guy Smith writes in the town hall, hashtag, what moral right does the audience member have demanding someone provide their labors, their life to someone else? We want to post some comments that came in to us through our website. If the several GOP governors and legislature would do what is best for the people instead of what they think is best for party politics, the ACA could do far more good for everyone. That was from David Teague. The next question, we're going to put this on the screen as well. I have insurance for the first time in 13 years. I cannot understand why any decent person would begrudge me this opportunity to finally get health care, from Tara Andolfini. And then lastly, our question, I'll leave you with this. What is the loss of local jobs, hours for health care staff locally because of the impact of the denial of Medicaid expansion? That comes from Vicki in Asheville.
Well, that's a tough question, and I'm just going to at least maybe narrow it down. Cody, has there been any impact in your industry in terms of the Affordable Care Act? Has it affected employment in some form or fashion? If so, how?
We estimate that due to the Medicare cuts in the Affordable Care Act.
Let me interrupt you. How many hospitals are we talking about in the state of North Carolina?
All of them. We have 130 more.
More than 130?
More than 130.
Okay.
We're looking at about $1 billion a year in cuts in Medicare because of the Affordable Care Act and sequestration and all that. Because we didn't expand Medicaid, we estimate that the state is losing out on $400 million in employee salaries alone, just for that one segment. So it's a chunk of change, and we're going to have to figure out how to make that money up somewhere else.
This is an opportunity for me to ask my last snap poll question of the evening. I'd like the audience here to respond with the sound of applause. Your two choices and answers are yes and no. Please respond to this statement. News organizations have presented the topic of health care in a thoughtful, impartial, and balanced approach. Those who believe yes, please applaud. Those who believe no, please applaud. In case anyone's interested, my resume will be posted in the back wall after tonight. Please tell us who you are, where do you live, and what's on your mind.
Hi, my name is Peggy Wheel. I live in Asheville. And I guess my question is for Cody Hand, and it addresses Medicaid expansion specifically and how it affects the hospitals in our state, particularly in our small rural communities. You're talking about cuts that are coming because of an anticipation that we were going to expand Medicaid. So now that our state has chosen not to expand Medicaid, what are the implications and how will it affect access to care to our communities in our smaller communities where we don't have, like a large hospital system?
Let me just say first off, we're doing our best to make sure it doesn't affect access to care. What we're worried about is in our rural communities who have a very large Medicaid population, we're going to get the patients anyway, regardless of whether or not they would have been covered or are covered. What we have to do in those situations is figure out a way to make up the costs that we lose by not getting paid to treat those patients. And a lot of times we have to do that by cost shifting onto our small businesses who pay their health insurance. It is one of the main reasons that health insurance in the private market is so expensive is because your providers have to cover the cost of the uninsured. Now, the Affordable Care Act meant to make sure everybody was insured, and that is a great thing, and your hospitals would love it if everybody was insured, but the access to care is going to be there as long as we can continue to pay the bills to keep the buildings open and the staff there, and we are doing our best to make sure that we can do that.
So my follow-up to that would be that the Hospital Association would benefit, and I mean not the Hospital Association, but your position is that Medicaid expansion is a good thing for North Carolina.
My position is everybody needs to be insured for it to be better, and if that's through Medicaid expansion, then that's how it should be.
Thank you.
Leslie, you're shaking your head. You wanted to weigh in?
Yeah, I think if part of the problem with not expanding Medicaid is that we, as taxpayers in this state, are still sending money to the federal government, and that money is not coming back to us. It's going to states that are expanding Medicaid, and the money that used to come to us to pay for the care for people who can't pay is no longer coming to us. So we are losing, I don't know, what's the figure?
At least $1 billion a year.
At least $1 billion a year. So we're talking thousands and thousands of jobs. We're talking, $1 billion a year or more. And we're talking the lives of 2,800 people who will die from lack of access to health care. So that's the cost.
I'll follow up on that.
Please.
So Medicaid advocates or Medicaid expansion advocates want to say that, hey, it's free. Medicaid expansion is free to the state of North Carolina. Yeah, that's true. For the first 3 years, the federal government will foot the bill. Fine. We're all taxpayers, so we're all footing the bill. After that, for the expansion part, the federal government will pay 90% and the state will pay 10%. According to a study by the Kaiser Foundation, the Medicaid expansion will cost North Carolina more than $3 billion over the first 5 years that we're paying. That's $3.1 billion between 2017 and 2022. That's real money that is going to have to come out of the state budget somewhere. So tell me, would you like to come out of education or the Department of Natural Resources or the Department or the State Highway Patrol? Where would you like that $3 billion to come from over those 5 years?
Tax hikes on the wealthy?
Oh, tax hikes. That's
the
the answer.
wealthiest?
Fantastic.
Yeah. I have a question for the panel, and earlier this evening I shared some polling results, again, going back to public policy polling of January 14th. 38% of North Carolinians support Obamacare, 48% oppose. But then also the Elon University poll of November 15th through 18th of 2013, that the number one issue as far as North Carolinians was concerned was health care and the ACA with 24.4%. But also in that same Elon University poll, it found that North Carolinians believed that under Obamacare, 53.6% believe it makes health care worse, and 30% believes it makes it better. And I'm a little confused because sometimes the numbers don't seem to make sense. North Carolinians say health care is really important to us. We're not certain if this is the right way to go. Am I right to be confused, or is there really something that kind of makes sense and I just don't understand it? Alec, what do you think?
It's definitely confusing. The law itself is a very enormous law. It's very complicated. It takes us speaking with people individually. We've probably spoken with 10,000 people in the last 6 months to try and explain it to them. So there's going to be a lot of conflicting numbers because people just don't understand it. And the other thing you'll find is when you start digging down into specifics of the law, most people prove that everyone should have coverage regardless of health conditions. Most people agree with letting children stay on the policies until they're 26. So a lot of the particular points of the health care reform law, people agree with. It's just the law is so complicated, it's very difficult to explain it all in a newscast when you'll have a few minutes to talk about it. It is a very complicated thing to get through. So that's why you're going to find these conflicting numbers, that maybe at a global level it doesn't look good, but then when you get down into it, you start seeing there are benefits. It's by no means perfect, but I don't think it's as bad as some people make it out as either.
And I think it looks like all of our panelists want to weigh in here. So Leslie, is this a matter of that everyone agrees with the end result? We know what we want to achieve. The question is, how do we get there?
I think that's part of it, but the other part of it, studies have shown that if you ask if people approve of Obamacare or disapprove, the disapproval numbers are much higher than if you ask if they approve of the Affordable Care Act. I have also seen someone signing up for insurance and saying, wow, this sure beats Obamacare. So, yeah.
Cody.
And I'll just weigh in from a provider perspective. It is very confusing, and your doctors and your hospitals are just as confused as you are about what the law means and what it does. We're still here providing the services for you no matter what, but we are ourselves trying to navigate through the however many thousand-page bill that was and the regulations that have followed that are even more confusing.
Donald?
I think if you read the name of the law, Patient Protection and Affordable Care Act, man, that sounds awesome. Great. And that's what everybody wants. Who would be against patient protection and affordable health care? Nobody. The problem is that you have things like higher premiums. The Manhattan Institute estimates that North Carolina will face an average 136% increase in premium costs. We were promised by our president and our U.S. Senator that if you like your plan, if you like your doctor, you can keep them. 473,000 North Carolinians lost their plans, and when they got them back, when they were given a fix for a year, Blue Cross Blue Shield announced that those costs would go, those plans that they had just a couple of days earlier would increase by 16 to 24% over the next year. It's a great name for a law, but the rollout's been terrible, and nothing about this is affordable at all.
All right. Now, we're getting down towards the end here. Before I get to this gentleman's question, I know a lot of folks at home want to be a part of this because the questions are kind of winding down here, but they're blowing up on social media. So let's go to our digital desk. Frank, what do you have for us?
Well, Mark, some of the questions we're getting, this is on our comment basically from our Twitter account. No guarantee expanded Medicaid dollars returning to North Carolina after 3 years. AFP NC CBO predicts that O-Care will still leave between 26 and 27 million Americans, nearly a tenth of the country, uninsured. Now, some of the questions that we have, will healthcare.gov automatically send children who qualify for Medicaid over to social services? That came into WLOS from Stuart Engel. And another question that also came into our website, Americans were told by President Obama that households would see an annual savings of around $2,500. Instead, our cost of health insurance has risen more than 1,600%. Why? Can you explain this, Mark?
So why has health insurance gone up if we were told it was going to go down? What do you think, Alec?
There's the essential health benefits. Those 10 benefits that every plan has to cover now is going to mean many plans are going to cost more. There were some very bare-bone plans out there, plans that had $20,000, $30,000 deductibles. Because of the law, no plan can charge more than $6,350 in total out-of-pocket expenses during the year. So it shrinks the amount of costs that an individual can incur before the insurance company starts paying. So what that means is you might have had a plan for $40, but it could have been very, very basic that still would have left you with tens of thousands of dollars worth of bills. So you're paying a lot more, but you're getting a much better plan. The other point, too, is I'm not sure what this person, when he put in their 1,600% increase, but subsidies are playing a huge role in helping keep cost under control for a lot of people. So I think you have to look globally, what is it doing when you include subsidies in there? For some people, yes, very definitely, they're going to face much higher cost. Other people are going to save significant amount of money when they get their subsidies. So it's a balance, and there's going to be people that come out ahead, people that do end up paying more, unfortunately, because something this big, there's no way to make it perfect for everybody. It just can't be done.
And quick follow-up with Cody. So was the president wrong because he didn't have the right information, or is it just part of the politics you talked about earlier, the salesmanship in order to get it passed?
I think that's exactly what it was. I want to go back to Donald talking about Senator Burr's bill that he introduced, I think it was Tuesday. I spoke with Senator Burr about it. The text is yet to come, but I think everybody from both sides should look at that bill and what it provides. It still protects pre-existing conditions. It still protects children under the age of 26. It has a lot of things that everybody likes about Obamacare, but it has a lot of the things that everybody thinks need to be changed. So I think we all need to get together and realize that there's got to be some changes to it, and maybe we should all get on the same page as to what those changes are, and I think that bill might go that way.
All right, I'm going to have to head back to this gentleman for our last question of the evening because we're just about run out of time. Please, quickly, it's going to be lightning round question.
I just wanted to clarify what Alex said when I sat down in regards to brokers and navigators and what's happening in the system and costs. It's not like buying a car. You don't negotiate a price. The rates are set by the Department of Insurance in the state, and the rates are exactly the same whether you buy from a broker, whether you buy from a navigator, whether you go online and get it direct. They are not, there's no difference. The only thing you have is an advocate in your corner with a navigator or a broker versus going in nebulous space on your own on a website that you can't navigate. That's why you don't want to do it by yourself. So I wanted to make that clear.
Okay, thank you. Well, we've kind of run out of time already for this evening, and you've seen a lot of spirited and passionate debate on a very emotional issue. No doubt about it, we all have concerns about this particular topic. But I think that even though we disagree, where some advocate everything from a single payer and larger government role to greater individual freedom of choice and individual decision, I think we can all agree that healthcare in recent years has gotten more complex, more complicated. There are more rules and regulations. It's made it more difficult for us to make the choices that we need to make. But the other thing we can all agree on is we all want affordable healthcare, quality healthcare at an affordable price, and not just for our parents, and not just for ourselves, but for the next generation, because we want to leave to our children and our children's children a better America than the one that we inherited. On behalf of our panel of experts, everyone here in the studio, and the News 13 crew, would like to thank you at home for joining us here this evening. And as always, we salute our military, law enforcement, firefighters, EMTs, and other emergency personnel for all that they do. I'm Mark Hyman. Good night.